Hello everyone, I'm Shakira from Institute for Public Health. So my topic is polysubstance use among adolescents in Malaysia. This finding from NHMS 2017. So this paper was published in Plos journal in January 2021. So as introduction, polysubstance use is defined as use of more than one non-prescribed licit or illicit substance either concurrently or simultaneously. So licit is include alcohol and cigarette, while illicit is include drugs such as marijuana, cocaine, heroin, and amphetamine. So the use of illicit and licit substance frequently start from school children during adolescence. So polysubstance or combination of drug is associated with more significant morbidity and mortality risk compared to use single substance only. In Malaysia, there were increased use of alcohol, tobacco, and illicit drug among adolescents from year 2012 and to 2017. However, there has been lack of research exploring the polysubstance use in Malaysia, especially among younger age population. So this study was conducted to determine the prevalence of single and polysubstance user and their associated factor among adolescents in Malaysia. So for methodology, we extract the data from NHMS 2017, which is Adolescent Health Survey, AHS. AHS is a cross-sectional study design targeted school-going adolescent aged between 13 to 17 years. So we sample all schools in Malaysia. We applied two-stage stratified clustered sampling. So data collection was done using validated self-administered questionnaire using OMR. So for study definition, we define substance use as any substance such as alcohol, cigarette, and illicit drug. While for single substance use is consume only one substance at one time. For polysubstance use is concurrent use more than one substance at the same time period. So for measurement, our dependent or outcome variable was categorized into two groups, which is non-user, single user, and polysubstance user. For independent variable included in analysis is gender, school location, ethnicity, parental marital status, protective factor, mental health problem, truancy, and bully. So we apply multinomial logistic regression analysis using Stata software. So for the result, a total about 27,000 students participate in this survey. For the characteristic of respondent is almost equal between gender, male and female, and from school, urban and rural. But the age group was higher among 30 to 15 years old, among Malay ethnicity, and those who married living with married parents. So for prevalence, this study shows that the prevalence for single substance use is 70.2%, while for polysubstance use is 5.1%. This is a weighted prevalence. The prevalence was higher among male for both single and polysubstance use. So for multinomial model, so we found that there was higher likelihood or higher odds of being single or polysubstance user compared to non-user among male student from other Bumiputras, Indian, Chinese, as compared to Malay, those who living with a single parent, who involved in truancy, being bullied, lack of peer support, poor parental bonding, having depression, and had no close friend, was higher odd of using single or polysubstance use. So this is a adjusted odd ratio for single and polysubstance use. So for discussion, the prevalence of polysubstance use in this study was 4.1%. This is lower compared to United States. This study found that alcohol and tobacco were the most common pair for substance use, while in USA is alcohol and marijuana. But in Southeast Asian, the combination of smoking and alcohol were the common co-occurrence of substance use among adolescents. So for predictor factor, male was higher risk involved in polysubstance use might be due to the peer influence factor or awareness. For younger age group, they were more likely to engage in single substance use might be due to the accessibility of the substance. And then for truancy, adolescents tend to skip school in pair and could lead them to use substance. For depression, numerous studies shows that there was associated between depression and substance or vice versa. And then for protective factor, previous study shows that lack of protective factor can increase odds of use polysubstance. So as conclusion, this study found that many significant factors which associated with substance use among adolescents. So this finding could have substantial implication for its prevention strategies. Much attention need to be given to prevent any soft substance initiation, especially at young age. So tobacco, alcohol, and illicit drug control program should focus on restricting adolescent access to such substance use. So thank you.